I worked on the National Suicide Prevention Hotline for 3 years. Suicide is something of I guess you could call it an interest of mine or a passion of mine, which I know sounds weird, but so a lot of times when people would call the hotline to talk to me about their suicidal ideation, no matter where they were on the spectrum of like lethality, suicide almost always is a last resort consideration for a sense of hopelessness and helplessness. Usually when people reach the point where they're thinking about ending their life, it's because they don't see any other options. And the pain is really strong and they want the pain to go away. And I had a supervisor one time tell me that suicide is the intent to kill. Often it's to try to kill the pain or to kill the source of it. But because a person can't do that, they choose to kill themselves. Again, it's a last resort. So the frame that we would often work through when I was talking with people on the hotline from midnight to 8 a.m. was to basically talk about the helplessness. Like, it sounds like you've run out of options, that it's hard to think of things that might have the ability to solve whatever problem that you're experiencing. The question I would ask frequently was, if there was maybe some other way that we could think of to alleviate some of the helplessness that you're feeling, would you be open to that? And almost 100% of the time on the phone calls, people would say yes. So I don't think that, like, suicide is so rarely an impulsive thing. Like, it's something that happens, it's thought through, there's plans, people meditate on it. It's very rarely impulsive. Kind of a misconception about it. So it's just sort of like paying attention to the emotional experience behind it. What is it that's driving a person to think about ending their life? And so many times when people have suicidal ideation, they don't actually want to do it. They're just considering it because it seems like all other options have been exhausted. So I think taking that frame is really important. And if the suicidal ideation comes to a point where it's really distressing, or if a person thinks they're going to act on it, that's what the National Suicide Prevention Hotline is for. Also what therapists are for. And that's also what the emergency room is for. But keep yourselves safe. But that's how I would answer that question, Piefly. I hope it's helpful.